Sean, why do you love full arch so much?
Full arch brings three things. When it comes to full arch, you want success.
Right.
You don't want an implant that just works.
What's your favorite implant?
My favorite is
How many doctors are doing full arch in US today?
2 years ago when I did the stat, it was about 50 locations that are doing it full time.
2003, you got your first implant. Do you remember what brand was it? Why 4M? What's the story there? So how tough was it to go through the past 5 years and build what you have built today?
I think the toughest part was going from 3 practices to maybe 5 or 6 creates a lot of expenses, a lot of growing pain, right? It's kind of like, I always tell people, it's like having 2 or 3 kids and then going to 4 or 5, 6 kids.
How should a doctor price the procedure? Sean, why do you love full arch so much?
I mean, that's a really good question. Full arch brings 3 things to everyone's career, which we all look for in a career. And those 3 things are work less, make more, and change lives. And that's what's truly fascinating about full arch, and that's why I love it so much.
Where did your journey begin? When did you start full arch? Or let's take us back.
Yeah.
When did you get into dental school, and tell us the full story?
My journey goes back a long way. 27 years ago, I graduated from USC Dental School. I was actually thinking of going to endo school. Thank God I didn't.
Oh, wow. Big difference.
Huge. At the time, I thought I loved endo. So I came out as a GP. Within about 8-9 months or so after associating, I started my own practice. I moved to Las Vegas.
Oh, wow.
Out of all these places. I graduated from USC, went to Las Vegas because I was just very eager to start my own business and get going. So, a year into it, I realized, okay, endo is not my thing, GP is not my thing. So I ended up going to LVI, Las Vegas Institute, for some advanced courses, got into cosmetic dentistry, full arch restorations, neuromuscular dentistry. So I went through all that for a few years. Still, there was a little piece of something missing, right? So then I got into implant dentistry. Just out of nowhere, I needed an implant myself, so I went to a periodontist.
In Las Vegas?
In Las Vegas that I referred to. So I walk in there, I walk out in 30 minutes with an implant.
Wow.
I'm sitting there thinking, gee, I've been missing the boat this whole time.
This is what year is that?
2003.
This is early in the implant game.
Yeah. So I'm like, God, I got to get into this implant deal. So I got into implant. I started taking some courses. I went through Loma Linda's Maxi course. Mm-hmm. And so as I was just learning surgery, I realized surgery is my thing. I was just, I loved it. I was good at it. So I kept going, got into full arch. Back then, there was no courses that would actually teach you the whole full arch A to Z. It was little pieces here, little pieces there. So it took me a good 3, maybe 4 years to really bring it all together. So that's kind of like my journey of how I got into full arch.
So 2003, you got your first implant. Do you remember what brand was it?
I was Nobel. I still have it.
Really?
It was Nobel, yeah.
And how was the landscape back then? Who were the players? What was the competition look like?
I mean, I don't remember the competition because I wasn't placing myself implants. So I don't know who was. I think Nobel was the biggest one, maybe BioHorizon and some of those ones were. But I think as I started doing it by 2006 or 7, then you had some other players that came into the game, yeah.
Did you come from a dental family or you were the first dentist?
No, I'm the first dentist. So I'm from a family of 4 boys, no girls. And I'm the last one, and I'm the only one who's in the dental or health profession.
What do the others do?
They're all in the business.
Okay.
They're all in the business. That's why I love this full arch because it brings that business side of my background, and I love surgery, so the two together just works well.
So Loma Linda, you learned implants basically, right? Implant therapy or?
Implants. So Loma Linda has a program. It's a 1-year program, residency, you want to call it. It's called Maxi course, where they teach you everything about.
Do they still have it?
Yeah, they have it there. Amazing. They have it at a few different places now.
And then when you graduated, so I'm just putting everything together. So 2010-ish, you started your own teaching journey. Is that the right?
No,
do I get the timeline
My
right?
teaching started in 2019.
2019.
Yeah. I was, doing some lectures for Nobel and before that, but my own institute, which is called 4M Institute,
Right.
started in 2019.
We get to that.
Yeah, yeah, it's a little further
Okay, so
out.
2010, you were just placing implants
Correct.
and doing full arch, because there's a video of you 10 years ago. You're showing full arch, and I want to go back to that video. But what were you doing? Where was that video recorded?
I think it was, I can't even remember, honestly, I think it was in my Las Vegas practice. We were doing a little TV infomercial type of thing.
Right.
So that's where I'm assuming. I haven't seen the video.
This is a full arch.
Yeah.
10 years ago.
This was full arch before all on four.
All on four.
So I was doing some of these back then, but not in all on four.
Uh-huh.
Not an immediate load
I see.
like we do
So
today.
how tough was it to do it back then? And if you want to compare it with now.
Oh my God. It took, a lot longer. You would place the implants back then the way I started. I would place the implants, bury the implants, give the patient a denture, come back in 6 months, expose the implants. I mean, it's just multiple surgeries, multiple appointments. Patients didn't love it because, they still had to drag on this whole process for almost a year.
Oh, it took 1 year for that to happen.
Yeah.
And how were you making the arches back then?
How?
Look at that arch.
Yeah. So if you look at that right there,
Let me just go
it actually goes straight into the implant. There was no multi-unit.
Oh.
Yeah, this was the prosthesis was basically sitting inside the implant, which made it a little bit more difficult.
Out of
challenging.
zirconia still, right? Or
Well, that
this is-
one over there you see is a
converted.
bar
it's a
bar
bar.
acrylic, but yeah, I mean you could make zirconia as well.
Pretty cool. But it has changed a lot in the past 10 years.
A lot.
Hasn't
I
it?
mean, the 3D printing, just that itself has made life so much easier. I had someone tell me, "Would you go back and convert a denture?" I'm like, "Not in a million years
Absolutely,
again."
Yeah, absolutely.
That's just such a big.
Pretty cool. So you moved from Las Vegas to LA.
So I still have my Las Vegas practice. I never really
wow.
moved that practice. I was fully living in Las Vegas back then. And then I moved to California with my family. I would still travel back and forth. I had a great life. I still do, but I worked 3 days a week in Vegas, and then I was off 4 days a week here. That's when I spent a lot of time with my kids. They were growing up. Now they're grown, but it was a beautiful time because I really had a good time with my kids. I spent a lot of time. It was like work 3 days, vacation 4 days. It was great.
That's amazing.
Yeah.
And how did you get into teaching?
So, all right, it was, 7, 8 years ago when I really mastered this whole full arch down to science and the business side of it and the whole thing. I really realized that there is a big population of edentulous patients and terminating dentition patients that are underserved in this country. And by finding that out, and these are patients that I would call dental handicap, right?
Right.
So-
Interesting name, dental handicap.
Yeah, they are. So these patients hang on to their ill-fitting dentures. They hang on to their loose and infected teeth simply because they don't know any options. They don't know about their options. And unfortunately, even their dentist didn't know about the options, right?
Right.
So these people are just going around. They what it does to them is they are socially impaired. They have no romantic life. I mean this is true. I mean, I'm not. It sounds like I'm kidding, but I'm not. When I deal with these patients, you see how deprived they are. They're unhealthy. They have high blood pressure, diabetes, depression. They can't eat well. They can't get a job. I mean, there are just so many things that these patients are deprived from. And so once I learned this and I realized how it's underserved, and I only can do so many under my own hands, right? I realized, okay, it's time to really have a bigger impact in the society, in this community. How can I do that? The only way is to teach other dentists and kind of bring the awareness up. And I think we've had a big impact on that. I mean, we've had, for the last 4 years, we've had over hundreds of doctors go through our courses. Not all of them start doing it,
Right.
but a good chunk of them do. And there are some of them that are very successful right now, very successful in it. I've also, opened more practices myself. So we have 9 locations now, and I was able to train my own doctors to be able to do these
That's
procedures.
very unique because having that 9 location and the teaching center.
Yeah, so it's
helps
worked
to-
in both ways. Not only we get to teach other dentists around the country, but also we get to train our own doctors. So each location has a doctor that can do all of what we're talking about, A through Z, really nicely.
So you started pre-COVID to
Yes.
teach pretty much.
Yeah.
And was the name always 4M? I think it was. I saw in the video. That was not the institute.
So the 4M name came about 5 years ago when I started the institute.
I see.
Before that, actually, I just had the
Albright?
Vegas off. Albright, that's
Yes.
right.
That's right.
It was called Albright.
And why 4M? What's the story there?
All right, so it's got a couple of different reasons. Number one, so I started calling it All on 4. That's what it was called, right? And then at the time, I wasn't using Nobel. So Nobel came after me saying, you can't use this name. We're going to, legal stuff. So
Right,
I had
right.
to pull out of that name. So I needed to come up with a different name procedure. So my last name is Mohtashami. So the M stands for that. The 4 stands for the 4, all on 4. And I have 3 daughters and me, so that makes 4 of us. So it all made sense. I'm like, 4M
That's
procedure,
amazing.
let's do that.
And the setup again, I visited it. There's a video tour that we created. If you remember, we at the same time released it. It's pretty prestigious. It's a combo of high quality dental care together with the teaching. What was the vision? Were you always envisioning that, or along the journey you started to perfect that?
Yeah, I'm sure you would understand. You can never see the final result. You start
Exactly.
somewhere, and as you open the door, and more doors open up, and then more doors open up, and you just keep going, right? I think that's really the key. A lot of people think of, okay, I need to have that vision all the way to the end before I get started. That's not the way it works.
That's right.
You start something, and it just keeps growing. So
That's
yes,
very true. I believe in that too. People ask me, have you always wanted the sprinter to become like that? I'm like, no.
You had no
You're
idea.
just surviving. You're just thinking about the issue of that month or that year. So how tough was it to go through the past 5 years and build what you have built today?
It's been actually very rewarding. I mean, obviously it's tough because you deal with so many things, but it's really, I would not change anything about it because most importantly, the people I've met, like you and so many other people, they have contributed to my success, to my knowledge. It's been amazing. Just the growth we've had through my team members
Right.
alone. It's been
Absolutely.
amazing. So it's been really good.
But you didn't answer my question.
What was the question? Maybe I missed.
What's the toughest part of it so far?
I think
in
the
terms
toughest
of-
part was going from 3 practices to maybe 5 or 6. That right there. So I was creating a platform, right? Creating that platform creates a lot of expenses, a lot of growing pain, right? So creating a call center, creating management system, accounting, all that stuff, like you keep spending money and you're like, at some point you're starting to worry, oh my God, am I going to be able to make through this? I think that was the toughest part. It's kind of like,
growth.
I always tell people, it's like having 2 or 3 kids and then going to 4 or 5, 6 kids. All of a sudden you're outnumbered.
Your bill goes
you're
up, yeah.
outnumbered, your expenses are high. And so,
Yeah, very true. And growth sucks cash.
yeah.
And it brings complexity, which requires more cash to solve and stay on top of. People don't appreciate it unless they go through it.
Yeah.
And from outside, everyone is like, yeah, I'm going to do a teaching center and a practice. But man, it's a lot of work.
It is. Yeah, it's a lot.
What keeps you up at night?
I actually don't stay up at night. I sleep really good, to be honest with you.
How is the competition for you guys from both full arch and teaching?
The teaching. So I want to say I was probably one of the first ones who put a complete all-on-4 or full arch course together, including the business and everything. But now there's a few other ones that are great as well. So yeah, I mean, there's not a huge number of doctors that are willing and wanting to go through this whole process. So it has sucked away a little bit from number of students, but I'm not doing it for the money part.
Right.
If I was for the
It's a
money part,
purpose.
I would say, yeah, maybe it's just not, it's slowed down a little bit, but I still do it because we love it. We have an impact through the courses, through the doctors that come through. We get to cherry pick some of the great doctors that can join 4M.
Oh,
So
that's amazing.
overall, it's actually still really good.
Staffing is an issue still
Staffing is always an issue.
in the dental.
It never goes
Very
away.
true.
It never goes, especially after COVID.
Yeah, totally. So going into the full arch, I want to break it down into two pieces. One, there's so much competition on the implant side of things. I mean, you felt it probably. It's a little bit of bloodbath when it comes to the implant market. And how do you choose your right partner? Or what's your favorite implant?
Right now, my favorite is definitely Neodent.
Neodent.
I've been using Neodent for the last 3+ years and just very happy, very happy. They're a good partner, even though they're growing. And, as any company, as they grow a little bit, service and certain things kind of drops a little bit. But still, I would say they're my favorites. They've been through, and my partner through the Institute. So quality, I still think they're one of the best. And so I'm still not going anywhere. I guess I'm
Do
I'm
all
sticking.
of them work? That's another perception that a lot of doctors have, that all implants work and only the cost is a factor. I want to hear your thought on that. And I don't have any dog in that fight, so I don't care. I want to hear your unfiltered thoughts.
I disagree with that.
You do?
There's a difference between implants working and implants being successful. So when it comes to full arch, you want success.
Right.
You don't want an implant that just works because, one failure, two failure in full arch, it'll come back and haunt you, and then it'll suck the profit out of you.
Right.
So I went from, I'm not going to name any companies, but I've used a few different companies.
Just name him.
Nobel. Nobel's been
Nobel.
around for a long time, and they are the ones that came up with this, obviously, all on four. And I'm sure at the time they were successful. But now that I look back, they really didn't make much improvement to their implant system. So you look at your Nobel cases from 5-6 years ago, and you have a lot of bone loss around them.
Oh, wow.
That implant is surviving. It's not successful. There's a difference
see.
between survival and success. Make sense?
Yeah, totally.
Yeah.
Success is still, survive stays there.
Yeah.
It doesn't fall off. But success to you is bone loss. That's how you measure it.
It's bone loss. It's looking at a patient, removing the prosthesis, looking healthy, implants, healthy tissue, something that you can be proud of, right?
Right.
With Nobel, unfortunately, I look at these cases, I'm like, oh my God, if I could, I would redo all this right now.
Right. Unfortunately, it's not possible.
But no, you can't for
Absolutely.
multiple reasons. So there's, the implant, the internal connection of the implant is very important. The multi-unit structure or the connection of the multi-unit is really important. One of the biggest factors that I found that differs between implants is at the time of the surgery, when you place the multi-units and you load these cases, over time, these prostheses or the multi-units, they come loose. It is what it is. You can't change that, right? Because of vibration, because of function, and so on.
Yeah, the screws get loose, right?
Get loose. So what happens, if it happens during that healing process of the implant, you'll get more implant failure. Now, with something like Neodent, that internal connection is a cold well connection. To give you an example, if you have been in a bar, I'm sure you have,
Sure.
2 glasses of beer
Right.
connected inside of it or placed inside of each other. You pick
yeah.
up the top one, the bottom
bottom
goes
one.
with it. That's a cold well
I see.
connection. So in the Neodent, for example, when the abutment or the screw gets loose, that has that same connection.
It holds it.
It
still
holds
in
it,
place.
so the whole implant is not moving anymore. Even
Right.
the screw gets loose, everything is still holding tight.
Interesting.
That's probably the biggest, I think, factor of success for me
Yeah.
when I look at these cases.
I'm a mechanical engineer by training, so that's what my undergraduate was. And in general mechanical engineering, you always put some sort of what we call spring washer, which is basically a washer. It is not in one flat plane, and all it does, it pushes the screw to the surface of whatever is holding. And I've been always fascinated why such a concept doesn't exist right now. Because if you care about loosening is a big topic, not just in implant. Imagine an airplane. If it loosen up, which will, there's so much vibration, it's catastrophic. So those issues are resolved in precision engineering and a super high risk engineering like aerospace and aircraft. But when it comes to implants, it's one screw. I wonder why no one has solved it.
That's a good question.
Maybe we should make a product together.
There you go.
Call it 4M washer. I'll do it with you.
4M washer.
And what about the concept of no abutment?
You know, I'm actually looking into that. There's a lot of parts that needs to basically for us from the institute part to kind of examine and test and make sure it works. I know it works well for axial implants that are straight. Unit. Yeah, well, not just single. Let's say if you're doing a full arch, but if your implants are all straight, it works great. But when you start having angled implants, right now one of the nice things about this full arch business is you don't have to have that much accuracy. So most dentists can pretty much do this 30 degree, 35 degree, 45 degree, 50 degree. No matter how you place your implant, you still have a multi-unit that can compensate for it. But with this, you just can't be at any degree. There's a certain level of accuracy that you have to have, which
I can imagine
maybe complicates a little bit.
That's very true.
So,
yeah, I've been looking into TRI. Is a good friend of mine who is the president for US. He's running it. It's pretty interesting. It's simple.
Yeah.
And I've been always wondering how it's working. So it's good that you're looking into it.
Yeah, we are. We're definitely.
2000, I think the video we watched was 2014.
Yeah.
What was the cost of treatment for a full arch back then?
What would I be charging patients?
Yeah.
About the same, actually.
Really?
Now that I think back, it was not that much different. I've always been somewhere between 20 to 25,000 range.
Per arch.
Yeah, per arch. The difference was back then my marketing expenses were lower.
Oh.
My operational expenses were higher because there were multiple appointments, more chair time, basically.
Right.
So now that flipped. Yeah. So now I spend more time on more money on marketing and then quicker, obviously, chair time. So it's somehow it's still the same.
But the awareness is also way higher than 10 years ago. I think thanks to education institutions like you.
Us, clear choice, the more marketing there's happening, the more awareness. Patients come to us asking, they say, I want that 4 on all or whatever it's called. They literally say that, they come to us.
Where does a patient start today? Like if a patient wants to know they're a candidate, what do they start?
They start by obviously sending us an email, showing us that they're interested. It's actually our job to be able to connect with them. Like I said earlier, they have a lot of emotional issues, social anxiety, and so on. So you really have to know. If you want to have a full arch practice where you're doing this on a regular basis, 15, 20 arches on a regular every month, you need to have a good trained team where they can connect with these patients and make it easy for them to come in. A lot of them are scared to come in or apprehensive. Once they come in, really, we provide a free consultation, free CT, so there's no apprehension again for them to come in. Once that CT is taken, then we explain to them, we show them models. Obviously, medically, we want to make sure that they're in good condition. And then from there, it goes on.
And 2 appointments, right? They can walk out. Is that really happening?
Yeah. So we have the consultation. Next day would be surgery, or next appointment would be surgery. And then depending on what type of restorative material they're choosing, they could have their final teeth the next day, or they go home with a PMMA and then come back 3-4 months for a zirconia.
And there are so much, as you said, you got to spend more in marketing. That means there's more competition.
There is.
First, who is a good candidate? How do you afford getting a full arch treatment?
Well, under our hands, everyone is a good candidate. I mean, there's very few very medically compromised patients that are not.
Everyone who has a removable denture, like a dentulous,
Everyone. Or because now with the advanced procedures, back then, if a patient was wearing a denture for 5, 6, 7 years, they really had no bone left, right? We call it maxilla atrophy of the upper jaw.
Sure.
So we would say, okay, now you're not a good candidate, just keep wearing your denture. But now with pterygoid, with zygomatic implants,
you can treat anyone.
We pretty much, there's not a single person that doesn't leave our practice with a fixed prosthesis after surgery.
And why fixed compared to removable? Would you share some of the benefits? And I'm sure you can talk for hours on that, but let's cover that topic.
A lot of benefits. So there's benefits from patient side and there's benefits from doctor side. From patient side, you leave the practice with a fixed set of teeth. So the discomfort, the annoyingness of a denture, rubbing, number one. You don't need multiple surgeries, right? If you give them a denture, then they're gonna have to come back at some point, and then you gotta numb them, cut their gums again, and then go to the next step.
Right.
So the number of surgeries just one time, and then they leave with a beautiful, aesthetically result set of teeth that's functional.
Mm-hmm.
I mean, what else can you ask for,
exactly.
right? In one visit, you go from wearing dentures and ill-fitting dentures or gum disease or whatever it is to a beautiful set of functionally stable fixed teeth.
Very
so
true.
That's from the patient's perspective and benefit. From the dentist, your success rate goes up because when you're splinting 4 or 5 or 6 implants together, now you have a higher success. Just like, me, I might have certain strength, but me, you, and him together, we're stronger, right?
Absolutely.
If we hold hands together, so that's the same idea.
And what about the quality of life for a patient? So I know the size is definitely a big factor. What about bite force? How different is the bite force or biting power with the removable versus fixed?
So initially, we obviously want to tell them not to go home and start biting and testing.
They do that, right?
Sometimes they
do that.
So whatever you tell the patient, they always do a little more, right? So we tell them for the first 2 weeks to 2 months, go really soft.
Don't bite an apple.
Don't bite an apple. Sometimes they do it. But once the implants heal, once they're integrated into your jaw, which is somewhere about after 10 weeks of surgery, they can pretty much do anything and it won't budge. The implants won't budge. During that process, if they go crazy, then they could have some consequences.
But they don't have it in the old school removable. Like that quality of life must be
no, with a removable,
day and night.
For months and months, you can barely even bite into anything. You can barely eat.
And then it becomes sore.
It rubs against their tissue. I mean, it's miserable.
Yeah, that's right. And also, I saw you also in another video, you said the palate and the taste is also gone because it's covering your palate.
Of course.
I didn't know that actually.
So a denture covers, in order to have suction with a denture, it covers the roof of the mouth, it covers all around. So you can't feel temperature.
Right.
You can't taste everything.
True.
So it makes a big difference in the quality of eating. And
what about on the doctor's side? This was patient. You mentioned on the doctor's side.
So the success rate, right?
Success rate, yeah.
So when you splint those implants together, now your success rate goes higher. Chair time goes less, which is more profit for the doctor, or they can reduce their price and have more cases. Right?
Absolutely.
So that's really the main advantage of it from the doctor.
How many doctors are doing full arch in U.S. today? Do you guys have any stats?
I had a stat about a couple years ago. I'm sure that has changed. Now, you have doctors that do 1 or 2 arches here and there, and then you have doctors that are really constantly doing it. I think a few years ago when I did the stat, it was about 50 locations that are doing it full time, all the time, on a regular basis. But now that has changed.
That's Clear Choice has 50 already, right?
Right, exactly. Clear Choice now has 100. 100, yeah.
Interesting. The our guesstimate, purely guessing, is about 1,000.
Now there's
not centers, 1,000 clinicians who are doing like what you do, dedicated to full arch. There are doctors who do, once a while or once in a month.
You don't count those.
But you don't count those. The true full arch centers that dedicate, which I think it makes sense. You got to go to those guys because the numbers, they dial in the process, the success rate must be way higher.
Yeah. I mean, I tell patients all the time, you don't choose us, it's fine. I won't get butt hurt. Just don't go to Mr. Joe who's done 1 or 2 in the last 10 years.
Exactly.
You got to go to a place who's doing this on a regular basis.
How should a patient choose? Because there's so much marketing. And I've seen ads 11,000 on arch. And then you go to another one, 25,000. So there's a big difference. And you can see it's a big decision-making factor for people.
I promise you this, for doing this for so many years, if anyone is doing it less than 20, they're not profiting so much because the cost of this whole process is pretty high. So those who are advertising at $11,000 or $12,000, they're doing what do you call a bait and switch? They get the patient in the door. They tell the patient, "Oh, you need 4 bone grafting. You need this type of implant. You need an extra implant." They raise the price up to 20 or plus. I've seen it happen. So it's not really. There's no way they can survive on doing this kind of work. Now, there's some centers that have also, they say $10,000, but that's just for phase 1. So they do the surgery, they give the patient a PMMA, that's the $10,000. Now, you want a final restoration, that's another 10 or 12, 15. So 20 really is the break point. You keep going.
Good quality and
be able to give patient a good service, good quality, and you still survive.
How much is with Clear Choice?
Clear Choice used to be, 25 to 30,000 an arch. Because of the competition, they've dropped it now. And it also depends on the time of the month.
Right. If they're behind on their numbers, they push it.
They drop their prices, yeah.
Oh, interesting. Yeah. They're part of Aspen now. So
yeah,
I'm sure they have their own revenue targets.
They do.
So what's the right for favorite number? Is it 4 or 6, or you stick to 4?
For the number of implants, I tell patients all the time, it's like a table with 4 legs, right? If those legs are strong and sturdy, you can put all the forces you want. You don't need a 5th leg or a 6th leg. The only time we place a 5th or a 6th implant is when there is not enough stability, when we want more teeth in the posterior, we don't want a long cantilever, or simply a patient who is really young and we want to give him a full set of teeth, not just up to the first molars. We want him to have a second molar, then we put some pterygoids that become 6 implants. So, but 4 is plenty unless there's other reasons to do 6.
Are more implants better for bone loss or not really?
No, absolutely. It's the other way around.
It's the other way.
Yeah.
I was in Malo Clinic in Portugal 2 weeks ago. Those guys started it, right?
Yeah, they did.
Paulo Malo wasn't there. The team was there. They said always 4. He said we're advocates of 4. And I asked that question from doctors too. That was interesting.
Because you have this small jaw, right?
Yeah.
You put too many implants, you're causing weakness in the bone. You're causing hygiene issues.
Yeah.
There's a lot of things that can come with just I've seen patients or cases where they put as many implants as they could, and it's a mess. It's a hygiene mess.
Before full arch, they used to do bridges, right?
Yeah.
That was like 10 implants in a...
Minimum 6, up to 8 or sometimes 10. Yeah, that's a lot of implants.
Do you convert those into full arch too?
Not if the implants are successful. If the implants are very successful, everything is good.
You just keep it there.
You just keep it there. But if they're, they have 50% bone loss and there's issues, then we remove those implants. Then we convert them into full arch.
So Sean, you also have a book.
Yes.
How did that happen?
I know. That was part of that journey that you don't expect, and it just happens.
It was published October last year, is that right?
October of 2023. Yeah.
So tell me the story. How long the process, why did you do that?
Well, yeah, that's a good question. The book is called "There's No Standing Still."
Right.
It kind of fits my personality because I don't stand still. I'm always on the move.
Nice.
But the main reason for the book was I've always been asked through sources, doctors, and how did I do it? How do I do it now? And it's not a simple answer, right? There's so many avenues, so many things that that needs to come together in your life, from personal growth to team growth to all that. So I figured, what's the best way to put it all together is through a book.
Amazing.
And that's how
Congrats
decided
on
to do
that.
it. Thank you.
How long the process took you? It's
Oh
not
my
easy,
God, it was a
man.
good 2.5 year
2.5
process.
years.
Yeah.
Did you do it in chunks or?
Yeah, I mean, you get motivated, you start doing it, and then you get distracted a little bit with business or work or family, and then you come back to it, and then it just keeps going back and forth. It's not something to where in a weekend you can just write it all up, and then you write it, and then you go back. There's certain things you don't like, you want to change, you want to add. So yeah, it is a process.
That's
Definitely.
amazing. Congrats on that.
Thank you so much.
The book talks a lot about the business aspect of dentistry. Is it just for full arch or in general?
It's in general, for sure. I mean, you can be a medical doctor, you can be anything, and this could apply to you. But at some points, we do focus on full arch.
I see.
Or implants, more like.
So can we
implant
open some of the topics in the book when it comes to business?
Sure. Yeah.
Share
Ask
it a
me,
little
and
bit.
what would you like to know?
Majority of the doctors I see, those numbers, margin and profitability, pricing, they struggle a little bit.
Yeah.
And let's start pricing. How should a doctor price the procedure?
Well, you need to go back and kind of have some statistics on what it is, what your expenses are like.
Right.
So this whole full arch really has three major parts to it, from the business perspective. One is creating the leads and being able to convert those leads into actual appointments. Mm-hmm. That's one category. And the second category is the internal part of it, being able to finance and sell these cases. And then the third category would be the whole clinical part of it. So a lot of doctors miss that first and second one, and they all focus on the third
clinical,
one. And then they keep wondering why it's not happening, or
why I'm not making money. Right?
Exactly. So you really need to break those three parts, separate them, learn and be able to understand it really well. So
how much is enough for the first part, which is marketing?
So, I mean, it's a tough question to just give you a price, but to make you kind of understand, you can be spending a lot of time or money on marketing, right? And then you're sitting in your office, you're wondering, where are these patients? I'm spending 20, 30 grand on marketing. It's not working. What the heck? The marketing is not working.
Right.
But if you really go back and look, do you actually have a trained call center?
I see.
A trained, group of people, whether it's one or five, or doesn't matter, that can actually convert those calls into appointments. If you don't, then there is a missing link here. You can spend all the money in the marketing and it's not going to result in anything, right?
Yeah,
it's like a
sense.
chain
Makes
reaction.
Sense. Yeah.
So before you spend money on the marketing,
You got to get this part covered.
make sure that your people, a lot of dental offices, I've said this so many times, 10, 15 years ago, that was me. Who answers the phone in the dental office?
It's the front desk, right?
The front desk, who is the least experienced and the least paid person in the dental office, and who is also checking out another patient and checking in another patient. And you can't be expecting a $50,000 lead to call you while the person doesn't know what to say and focused on the million different things. It doesn't work that way. So you need to have that focused one or two people who are trained how to overcome objectives. These patients have issues, like I said, they're depressed and so many things. You need to be able to connect with them on an emotional level. Then that's how you make that appointment. Yes, exactly. So then from there, now you need to figure out the internal part of your practice. Your financing, patients come in. These patients are not wealthy. If they were wealthy, they wouldn't be missing teeth, or they would, right?
It's different. Yeah.
So you have that. They're mostly those blue collars. So it's not like they're going to come and just write you a check for $50K. You got to learn how to make it affordable for them through financing. So that's another art of itself.
Art of selling or partnering? And
Art of selling and financing, it's all
see.
one. First, you got to get the patient to a level where they're like excited. Yes, I want to do this. I don't care if it's costing me 500
much.
bucks a month or whatever it is. And then you got to be able to get it done or get it financed for them. And then the third part is getting the clinical part of it.
The operation
The
part
operation
of it, which
part of
is
it, yeah.
also...
It doesn't work backwards.
No, doctors get it the opposite.
That's it. That's the problem.
So on the marketing side, do we typically measure our investment by a percentage of revenue? Is that how you guys measure it too? In our industry, at least?
Yeah, we're not as probably as savvy as you guys are, but yes.
Can I put you on the spot? How much do you spend in ads monthly?
Marketing?
Yeah.
Well, we spend, I can't give you a number because it depends on how many practices,
Sure.
how many arches you want to do.
Oh,
So it
that's
won't
right. I
make
have 9
sense.
locations.
Yeah. But we spend somewhere between 15 to 20% of our revenue on marketing.
That's good. That's healthy.
Yeah.
That's very healthy.
Yeah.
That's what my
Most dental
target is.
offices don't do that. They feel like they should be spending 5 to
No,
7 or
it's not
6.
enough.
And it's not enough. For full arch, it's not enough.
Got it. And is it mostly ads? I see TV ads too, right?
So we have social media, we have TV ads, we have, Google and those kind of things. We have some print. You got to cover just about everything.
And you teach all of these in your courses too.
I personally don't teach that part of it, but I have people that do teach
Yeah,
it.
but the Forum
Yes,
Institute
the course
does
has
that.
that whole, and it's not just about teaching it. We also provide mentorship,
Right.
in
Oh, perfect.
all aspects. So someone wants marketing, we've got a mentorship in marketing. Someone wants clinical mentorship, we've got clinical mentorship. So we really do try to cover it all.
And where is it that most dentists screw up the business? Is it that part or...
It's exactly what I said. They just feel like once
The
they know
last
the
part.
clinical side of it, oh God, that's all I need to know. The clinical part of it is the most important part.
Right.
They don't realize there's so much more,
And 9 offices, you didn't build it all by yourself. You had help, right? Or no, the 9 offices you've been really
I mean, I had help in
not
building
standing still, right?
But-
Where did you get the
but I-
expertise?
I have a team, obviously.
Right.
I have a dental design team. I have the equipment team, and then I have the operational team. So each team really does their job, but at the end of it, yeah, I'm really the one that
You're
makes it
running it.
happen. Yeah.
I've seen on the general finance, cash flow management, those kind of things. A lot of them is a struggle, especially when the number of offices grow. Just managing cash, right?
Yeah.
From your AP to AR to this
And
is
all the 9 offices are really self-funded. So we
That's
don't really
amazing.
have a partner yet.
kudos to you for that.
Thank you.
'Cause a lot of people think bringing investors is like yes, we did it, but it's a big obligation,
Really.
and not doing it is a big win.
I mean, I figured as long as I can
You
stretch
live.
it, maybe it's a good thing.
That's
Some people
amazing.
say, though, it helps you if you do bring it, it helps you in your growth faster.
Right.
So there's, I guess, a give and take. I don't know.
And do you measure EBITDA, those kind of metrics too?
Yeah.
You have targets
Yeah.
for your team?
We do. I mean, we're not gung-ho about it because we're not looking for an investor.
Sure.
But when you're getting ready to that point now, you really have to nail it down, right?
Yeah.
So right now, I'm not too worried about it because of the growth. We're a little extra spending in certain areas. I'm kind of
It's founders driven. So that's why it's like that. The moment a PE come in and start
It is
squeezing
crazy.
it. That's how it is. To increase EBITDA, they either gotta negotiate with vendors, grind the vendors, or pay lower wages, which
Yeah.
you can't. Typically in your industry, you can.
Yeah.
They're going to charge more, and it's become tough. And I talk to CEOs of bigger, like 400, 500 dental office organizations. It's pretty tough job to increase
It
EBITDA,
is.
especially PE, which is essentially you're hired to grow it and then flip it. You know how they do it?
So the thing about me and 4M is that honestly, I'm not thinking about flipping it. I just
I was
love what
gonna
we're
ask.
doing. I've created a big 4M culture family that I just love. And it's like one big happy family right now. I just don't want to ruin it, honestly. I don't
hear
want
you
to
on that.
bring a private equity and then it gets all ruined, like you said.
Yeah.
Cut this, cut that, and then everybody's unhappy.
So
I
what's
don't
the vision? You just want to keep growing it?
So my oldest daughter, or all my 2 oldest daughters, are going to dental school are going to go to dental school. One of them is already accepted into UCLA.
UCLA.
Yeah, I know, right?
Come on.
So she's gonna start this year. The other one is has got 3 more years. I have also my niece who is in dental school right now.
Okay.
So I have a lot of family members that are
That
becoming
only
dentists.
jobs.
So I don't know. I don't know if I want to.
Interesting.
Yeah.
So your daughters are all going to go to dental
So
school?
I have 3 daughters.
Right.
The youngest one is too young for now. The oldest one already got into UCLA dental school. The second one is considering. Obviously, she still has 3 more years.
How much did you influence that?
Honestly, I didn't.
You didn't.
Not a word of, because I wanted them to choose and be happy. So when they did come see me in action, teaching and the facility and what we do, I guess they're smart enough to say, why would I want to do anything else?
And I probably, they don't know it now, but it's a blessing to have that for them backing so much extra training, extra help, and just a future career aside, just through dental school. Yeah, it's a different,
They're
right?
already exposed to so much.
Exactly, and they can get extra training here. Gonna have so much fun at the dental school just talking about you. Do you think of teaching in academia? Have you thought of one course or 1 day a week, those kind of things?
It's no, I haven't, honestly. Only because what I want to teach is at such a high level that the dental students they can't even grasp it right now.
Yeah, UCLA. Does the second one want to go to UCLA too?
She's at UCLA undergrad right now, but she hasn't really even applied.
Might be good just for them, just build some relationship because they respect you a lot more.
Yeah.
Just to give them more extra privilege in dental school, just build a relationship with the dean. That's what I would do if I were you.
Yeah.
Because then they get treated differently, which means you want. Yeah. They treat them differently. Either
but
you do
I want them to also find their own way, fight their own way.
Pave their way at least, if they take it or not.
Well, the way, once they come out of dental school, it's already all paved for them. But during the dental school, getting there, I kind of want them to suffer a little bit.
Yeah.
I suffered a lot.
Your undergrad was at USC too?
No, I was at UC Irvine.
UC Irvine.
In Orange County, yeah.
Amazing. You grew up in California?
Yes.
What did your parents do?
My dad is also a businessman, but they're all back home in Iran.
Oh, wow.
They don't live here.
Amazing. So you're like me. You're the only one.
Thing,
yeah. Sean, thank you for coming to the podcast.
That's great.
It was fun. Got to do episode 2 sometime soon.
Yeah, sure. Anytime, man.